So, good evening, everyone. Uh, Today we are back on a live session with our guest speaker, Dr. Ram Prasad More, who has been, who is a MD homeopathy. He has done his MD in medicine, and he practices in uh, Tar- Tarni village, which is near Jalna, since past 4 years. And within a short period of time, he has gained a good reputation in his practice. And our speaker, Dr. Kamleshkakde, as we all know, is a um, is a wonderful homeopath working in Nagpur since past 15 years. Uh, he is a founder of Us Health Foundation, and he has been recently doing a lot of research work in autism and cervical dystonia, and is well known for his results in so-called incurable pathologies. And also, he is currently a teacher in Wish homeopathy, which uh, which is being taught globally. So today we are here to discuss about seasonal affecting diseases, which uh, which is more common in monsoon and such kind of weather. So over to you, sir.
Okay, first of all, let me introduce our guest a little bit. Dr. Ram is very enthusiastic in learning. He's MD in medicine and he's a very good friend of mine. And uh, he's so eager to learn and he's passionate learner. And because of this quality, he's a wonderful physician. And this is the reason why he has gained a huge popularity in his area.
Thank
Basically, he
you, sir.
practices
Thank
in
you.
basically he is practicing in very small area, small town, but he is doing such a wonderful job there with lot of perfection, dedication, and education. This is most important for me. He is such a wonderful human being, and he is best friend of mine. So over to you, Dr. Ram.
Thank you, sir, for appreciation of my work. Appreciation of my work. Sir, we are discussing today's topic, that is seasonal affective disorder. Sir, I would like to ask you, does environmental factors and uh, the seasons such as rainy season, summer season or winter season does affect our health or not?
Yes. So as we all know that humans are very complicated organisms, right? It is most
Yes, sir.
advanced and complicated creature on this planet.
Yes,
And
yes.
when I say complicated, what do I mean by that? Complicated in terms of anatomy, complicated in terms of physiology, and
Physiology.
also in terms of psychology.
Yes,
So
sir.
humans have very complicated psychology, and as it is complicated, that's why it is very sensitive to.
Yes,
So
yes,
it is sensitive to slightest change in environment, slightest change around him, slightest change in his hormonal uh, balance. So yes, psychology, human psychology is affected, can be affected by even slightest change in atmosphere, temperature, humidity, even presence of sun or moon. So all these factors can affect human psychology. So
yes, yes,
Dr. Ram, as you are a very good physician and as you are working in very small area, so your
yes,
first line of defense in terms of health there, right? So if there is
Yes.
any complication, people rush to you first and then they come to big cities and big hospitals. So
Yes, sir. Yes, sir.
I believe this is very challenging job. And today it's our topic, that seasonal affecting disorder, which is also called as SAD.
Sir, we don't have any physician around 50 kilometers of my village.
Yes, yes, yes. True,
If there is any emergency, we have to manage at our levels and then send it to higher centers
true,
or
true.
consulting physicians.
Yes. And
It's
that
very
also
tough
with
and
limited
challenging.
resources, right?
Yes, yes, sir.
Ah, so it becomes very challenging job to manage this. But Dr. Ram is doing fantastic work because of his knowledge. So, Dr. Ram, I want you to throw some light on this disease actually. What is SAD? What is seasonal affective disorder? Can you elaborate? Because I believe that most of our viewers, they don't know about SAD. What is SAD and what is seasonal affecting disorder? So can you define this? Can you throw some light on what is this disease actually?
Sir, this seasonal affective disorder is is characterized by major depression at same season at each year, at least for each 2 consecutive years. It is characterized by depression. All the symptoms are uh, of depression. Depression. It is characterized by depression. There are all the symptoms that are comes under major depression, but it is due to seasonal changes. Seasonal changes means when there is days are very shorter and nights are very lengthy, then human beings are uh, less in contact with the sunlight. That sunlight, uh, our brain, as you told earlier, that human being is a very complex machine. It is it is it's a very complex machine. They react to each and every stimuli around him. So when there is a low light, our body makes some hormones that makes human beings mood very sad, makes human beings unhappy. That mood stabilizers we have in our blood, normally they are secreted as we come in contact with the fresh light of sun. That are serotonin, norepinephrine, and many more are hormones that are that are secreted by our brain in response to light. When there is less light, our body makes exactly opposite hormones to that are melatonin. When melatonin, our body less exposed to sunlight, our body brain may make more of melatonin. That makes human beings very lethargy, tired, fatigue, and more they like to sleep more and eat more. They eat more and more, but they don't feel energetic. These are the chemical changes that that happen in our body in response to the low light. And low light, generally, if there is days are very sunny, our daily activities are very enough to maintain our energy levels. When there are duration of the days are very short because of less sunlight, uh, we we would like to stay at a home. These chemical changes affects our mood and day-to-day activities. This is seasonal two main criteria for seasonal affective disorder. Depression comes that same days of year at least for 2 consecutive years, and the symptoms goes away their own when season changes. These are the very characteristic of that seasonal affective disorders. Over to you, sir.
Oh, great, great. So, what else can we talk about this seasonal affective disorder? Probably, what are the
Sir,
signs and yeah?
what are the all the symptoms are of depression.
Uh-huh.
Depressions, all symptoms comes under this seasonal affective disorder.
Mhm.
Sir, I would like to ask you what type of peoples or what age group or what type of peoples are at more risk to develop this condition?
Yes. So basically, seasonal affective disorder is more commonly seen in females than in male.
Yes,
And after the age of 20 years, it is more common.
yes,
Also, there are some genetic factors that if any person have this family history of seasonal affective disorder, then these people are more prone to develop this disease. Also, if some people have some existing psychological diseases like bipolar diseases, like depression, so these people are more prone to have this disease. They are more sensitive to seasonal changes, and these existing symptoms can aggravate it with the change in season, especially in winter or in monsoon. So this is very important season for having this such type of conditions where days are
yes.
very short and nights are more, and where there
Very
is less
lengthy.
sunlight, and also in locations where, like in north or south pole, where days are small and nights are long, where they cannot see sun for months together sometimes. So in these areas also, stag is very common. And yes, there are some evidences that shows that if you have low level of vitamin D, then also this disease is more commonly seen in those people. So these are the main factors. And also, as you said, that these people have all the sign and symptoms of depression and
Depression.
sadness, and also there is change in sleeping pattern also.
Yes. They sleep
So
more and more.
yes, there is change in diet habits also.
Yes.
These people may feel
They
that
like to overeat.
yes, and also they feel very sad, they feel low of energy, they don't want to do their routine work, even they don't feel happiness in their regular hobbies. They
Yes.
don't want to do their, if someone like to watch series, web series. So suddenly he started to feel like, oh no, I don't have interest now. I don't want to watch. I just want to sleep, lie down. It is feeling so dull. So sometimes we feel that these are because of weather, and we neglect these symptoms. But we should be very careful about such type of emotional changes also, because
Yes.
lot of time people are very careful about their physical symptoms,
Yes.
but they are negligent about their emotional symptoms. So we
Yes.
must be very careful about our emotional symptoms, because these emotional symptoms can lead to very grave or big disease. It may hamper
Yes.
your life. It may affect you in many ways.
Yes.
Hmm.
Yes.
Yeah. So I just want to ask you, Dr. Ram, is there any way that can we prevent such type of disease, seasonal affecting disorder?
Sir, as we know, basic pathophysiology or basic cause of the disorder is less sunlight or less activity. There is no such a technique or any method to prevent this disease, but we can take care of our mental health and observation of our mood. If there is uh, any symptoms and signs which are related to the depression, we cannot prevent, but we can do some measures to overcome, to cope with this yeah, sad, as we can do daily exercises or use more sunlight, uh, use more sunlight. We can play outdoor games. We can make the contact with the peoples who are very friendly to us. We can share our emotions and feelings to them.
True, this is very
There are
important.
no, yes, there is no such, there is no any specialized way to prevent this disease, as it is because of season, day-to-day activity, exercises. We can take a balanced diet, as you said earlier, that vitamin D3 is very important for um, our body. It is involved in synthesis of many hormones, that is serotonin, norepinephrine, dopamine. It is involved in synthesis of these hormones that makes or that regulate our mood. So we can take vitamins and balanced diet, that we can with the help of these measures uh, we can prevent the sad. Cannot prevent, but these are the measures.
Very good. But our viewers like to know about these measures. Na? If there is disease, then there should be some treatment and there should be some precaution we should take.
Yes,
So this is very important, I hope. Thank you so much for
yes,
sharing this.
yes, yes, sir. Sir, I would like to ask you that when cases of depression or cases of sad, when comes to you, what would be your approach to see the cases?
Yes. So basically, homeopathy, as we all know, that homeopathy is a holistic science. And in this
Yes,
science, when any patient come to us, we consider he may be he may come for any disease. Maybe may it be
yes,
simple fever to big pathology like cancer. But in all the cases, we consider patient as a whole. And when I say patient as a whole, what do I mean by that? I mean that we consider patient's mind and body both together. We try
yes,
to find out characteristic symptoms at both the level. We try to understand the patient as a whole, and then we try to prescribe, find a similar medicine, and then we try to prescribe. And this medicine is capable to bring changes on both the levels simultaneously, on the mind level as well as on the physical level. So
yes,
this is the basic approach in all the cases. So mind is very important part of our living, of our life. So we cannot neglect mind when it comes to treatment. Because in disease, may it be physical disease, but your mind is affected together with your body. So we
yes,
must
yes,
consider your mind with your body. And when we do such type of holistic treatment, then this holistic treatment is able to cure unbelievable, almost incurable pathologies also. Like as Dr. Vinaya told, that we are doing research on autism, we are doing research on cervical dystonia. So these cases are considered as incurable cases in
Yes.
modern science. But we are doing, we are able to help patient consistently, remarkably in each and every case. When we study like this, when we consider patient as a whole, and when we prescribe accurate homeopathic medicine, then results are wonderful. Wonderful. Yeah.
सर जैसे कि अपने टॉपिक ने चुना है सैड। जैसे हमारे पास बहुत सारे पेशेंट आते हैं ऐसे ग्लोमी और ये वेदर में बोलते हैं क्या वातावरणच असं झालंय, बरोबर वाटत नाही, त्याच्या माग बेसिक पैथोफिजियोलॉजी ये रहती है सर।
True.
पीपल दे डोंट नो।
Yes. Yes.
पेशेंट आते हैं और बोलते हैं कुछ करने को दिल नहीं कर रहा है, ये सीजन में आते हैं, कुछ करने को दिल नहीं कर रहा है। वो दिन दिन भर 2-2 3-3 दिन भर जैसे बाहर वेदर अच्छा नहीं रहता है, बारिश रहती है, वो घर में बैठे रहते हैं, कुछ करने को दिल नहीं करता। इसके पीछे की पूरी बॉडी की जो पैथोफिजियोलॉजी जो केमिस्ट्री है जो ऐसे करती है, तो उनको पता नहीं चलता है क्या हो रहा है उनके साथ।
Yes, probably because after this Insta Live, this talk, lot of people will come to know that these type of symptoms are actually part of some psychological illness, some disease, and they will get more aware about all these changes, which
यस यस सर।
in general people may think that it is a part of routine, or maybe because of weather changes, or they take it very casually. But
हम्म।
I believe after this talk, after this Insta Live, people will get more aware about these symptoms. So
यस।
this is the aim of this Insta Live, today's Insta Live.
जो बायोकेमिकल चेंजेस हो रहे हैं उनके अंदर, वो उनको इन्फेक्शन से या फिर बाकी जॉइंट पेन है, जो क्रॉनिक केसेस में जॉइंट पेन रहता है पेशेंट को, अनकाइलोसिंग स्पॉन्डिलोसिस हो गया, आर्थराइटिस हो गया, जो कुछ उनको क्रॉनिक प्रॉब्लम रहता है, तो जो बॉडी के अंदर बायोकेमिकल चेंजेस हो रहे हैं जिससे मूड चेंज हो रहा है, तो उनसे वो जो उनके जो कंप्लेंट्स है वो भी तो वर्स होते हैं, और या फिर उनकी बॉडी इन्फेक्शन कैच करने के लिए मेरे को लगता है प्रिडिस्पोज हो जाती है या जल्दी इन्फेक्शन कैच कर लेती है,
True.
ऐसा मेरे को लगता है।
Yes, yes. This is very true. This is very true. True.
जैसे बायोकेमिकल चेंज बॉडी की पूरी पूरी की पूरी केमिस्ट्री रिवर्स हो रही है, जो सार्केडियन रिदम कहते हैं, जिसमें रात को मेलाटोनिन सिक्रिट होना चाहिए और दिन में जो हमारा मूड स्टेबलाइजर है, मूड क्या बोलते हैं उसको, मूड रेगुलेटर है सीरोटोनिन, वो जब ऑप्टिमम लेवल पे रहना चाहिए। तो वो अगर नहीं रहेगा तो बॉडी भी उसके हिसाब से एक्ट करेगी, तो वो जॉइंट पेन और वो भी सब बाकी के भी जो कंप्लेंट्स है वो और ऐड कर जाते हैं डिप्रेशन में, वो ज्यादा
True.
डिप्रेस कर देते हैं पेशेंट को।
True. True. Because unhealthy body cannot hold healthy mind.
यस यस।
So your body must be
तो
healthy. If it
यस
is
यस
deficient of any nutrients, or if it is not feeling well, then it cannot hold healthy mind. So your mind will be
यस
affected in terms.
यस यस यस। तो पेशेंट को अपने मूड को लेकर ज्यादा सतर्क रहना चाहिए ये सीजन में।
Yes, yes. Very important. This is very important. So, Dr. Ram, is there any genetic role in development of SAD?
Sir, there is no such a known role of genetics in development of that SAD, but जिनके फर्स्ट डिग्री रिलेटिव जो है उनको कुछ सैड डेवलप हुआ है, सैड जो सीजनल अफेक्टिव डिसऑर्डर बोलते हो, वो डेवलप हो चुका है या हुआ था, या इनके फर्स्ट डिग्री रिलेटिव में किसी को और कोई साइकोलॉजिकल प्रॉब्लम है जैसे कि सिजोफ्रेनिया है, तो उनके फर्स्ट डिग्री रिलेटिव्स में ये मतलब ये ज्यादा रिस्क पे रहते हैं डेवलप होने के लिए। जो जो सीजनल अफेक्टिव डिसऑर्डर है ये उनमें ज्यादा देखा जाता है।
Okay.
ऐसा जेनेटिक तो कुछ नोन नहीं है उनको, बट जिनके फर्स्ट डिग्री रिलेटिव में ये बाकी साइकोलॉजिकल कंडीशन है वो ज्यादा वल्नरेबल रहते हैं डिसीज के लिए,
Hmm.
डिसऑर्डर के लिए, सॉरी।
Hmm.
Sir, I would like to ask you, is there any role of exercise or outdoor games? uh, जो आउटडोर गेम्स है, जो डेली एक्सरसाइज है, या फिर अपन कुछ म्यूजिक सुनते हैं, या कुछ और अपनी हॉबीज है, इनका कुछ रोल है क्या? ये कुछ मूड इंप्रूव करने के लिए या ये सैड्स में कुछ मतलब सुधार ला सकते हैं क्या?
Yes, definitely. As I have told that mind and body are connected with each other very strongly. And when one is
Yes, yes.
affected, other is affected. When mind is affected, body is affected. When body is affected, mind is affected. So if we will try to do some physical exercises, if we'll try to pursue our hobbies, so it will help to bring our mood up. Like exercises produce some happy hormones, and this may in turns affect in a positive way on the sad, and sad symptoms will come down. So doing regular exercises, yoga, pranayam, deep breathings, having good food, healthy natural food on proper time, these are very good healthy habits to decrease the symptoms and intensities of sad. So this is very
Yes,
important to have healthy routine, healthy diet, and healthy lifestyle. This will always affect your mood. This is always boost your mood. This will always help in keeping you healthy on both the
yes.
levels, mind and body. So, Dr. Ram, is there any effect of minerals, vitamins like vitamin D or some other minerals, vitamins on the uh, manifestation of SAD?
Sir, vitamin D3 has vitamin D3 deficiency having very strong association with seasonal affective disorder. As we told earlier that vitamin D3 is involved in the synthesis of serotonin, norepinephrine and dopamine. डोपामाइन, सीरोटोनिन एंड नॉरएपिनेफ्रिन ये सब ऐसे हार्मोन हैं जो अपन के मूड को रेगुलेट करते हैं, मूड इंप्रूव करते हैं। तो विटामिन D3 अगर लेस रहा तो ये सब हार्मोन्स नहीं बनेंगे जो अपन की बॉडी को, ह्यूमन बॉडी को हैप्पी रखते हैं। ये सब हार्मोन नहीं बनेंगे, तो इसलिए मेलाटोनिन का जो बैलेंस शिफ्ट है वो मेलाटोनिन की ओर हो जाएगा, और बॉडी सब के सब मतलब ये जो स्ट्रॉन्गर हो जाएगा मेलाटोनिन, तो मेलाटोनिन जो हार्मोन है उसके इन्फ्लुएंस में ज्यादा रहेगी। तो ये सब सिम्टम आते फिर डिप्रेशन के, जैसे ज्यादा सोना हुआ, ज्यादा खाना हुआ, डिप्रेशन के टोटल सिम्टम्स ये सब आ जाते हैं। तो विटामिन D3 एज जैसे आपने पहले भी कहा है कि ये इसके पीछे की पैथोफिजियोलॉजी या फिर बेसिक कॉज ये है कि सनलाइट को कम एक्सपोज होना। तो इसीलिए अगर सनलाइट को कम एक्सपोज हो जाएगी तो वैसे भी विटामिन D3 कम आएगा, और विटामिन D3 अगर लेस है तो फिर ये सब जो हैप्पी हार्मोन्स है वो कम बनेंगे। तो विटामिन D3 has a very strong association with that development of seasonal affective disorder.
I believe after today's talk, lot of people will be aware about their emotional state, especially changes which occur after seasonal changes in this monsoon or this winter season. And thank you,
Yes.
Dr. Ram, for sharing all your knowledge and with in such a simple language, so as to even common people can connect and understand all these concepts. So thank you so much. I think uh, now we can stop here and